pleasure to meet you. Hi, how's it going? Why don't you have a seat over here on this chair, and we can continue with your examination. Okay, fantastic. Come over here. Hey there, and welcome to Dr. Nathan's clinic. I hear that you're here to get a physical today. That's fantastic. Well, I have the form that you filled out in the waiting room. And I'd like to just quickly fill out a few of these answers here, and then we can begin the examination. Okay, great. Let me grab my pen here. Now, let's see here. So, what is the main reason for your visit today? Okay, so you're just getting a physical, but you're feeling a little off, so you just wanted to double check to make sure that there's nothing wrong. I understand. Well, you've come to the right place. So, let me see here. I need you to sign this waiver here. We're able to, and we will need you to fill this out later. This is going to just be your personal information for the office use. But we will be... Let me sign this waiver real quick here. Okay, this looks like the right one here. If I could just go ahead and have you just initial here and consent there. Just okay, thank you so much. Just a date there, yeah. Okay, let me have this back here. Okay, so no real problems here, no problems. Respiratory, no problems. Gastrointestinal, okay. Cardiovascular, we'll be checking that in a little bit later. In fact, we'll go through some of this in our examination, but I just wanted to quickly check here. And the date, of course, here it's Dr. Nathan, and here we are. Okay. All right, so this looks great. I'm just going to put your paperwork over here, if that's okay. And I do have documentation here. Just check here. Okay, fantastic. So, what I'd like you to do first here is why don't you, we'll go ahead and take our blood pressure, and your temperature. I think that's the best way that we can begin the process. So let's go ahead and do that now. Okay, so we have our blood pressure monitor here. So I'm going to have to just go ahead and ask you to here we go. Let's just put this here. Fantastic. Okay, and so I'm just going to count to 3, and I'm going to give this a little bit of a pump there. Sorry, there's a little hair in my face, but let's go ahead and do that here. It's not getting too tight, right? Okay, and we are seeing here. Okay, fantastic. And that's normal. Okay, so the blood pressure is normal, and I'm going to go ahead and just remove that. Okay, oh, that's okay. Okay, so now I'm going to go ahead and I'm going to put this, check your temperature real quick, so. Okay. Just do this here. Okay. It's showing up 98.2. That's a little bit on the lower side. 98.6 obviously being the optimal temperature there. But it seems within the sort of the realm of healthy. So we'll just go and put that down real quick. Okay, fantastic. So now we are going to go ahead and we are going to check your put this here. And we're going to go ahead and check your nasal cavities. Now, I'm going to need to take this light here and I'm going to need to put it up your nose, your nasal cavity. So I hope that's okay. And so here we go. I'm going to just go ahead and put that right there. I'm going to use this to shine a light. As you can see here, it's going to be just sort of like that so I can see just a little bit. So let's see what happens here. Okay. Everything looks normal. So that's great. Okay, so now we are going to go ahead and we are going to check your vibration sensitivity. So we're going to be using this C-tuned tuning fork, which will vibrate. And what I want you to do is I want you to just tell me if you feel a vibration, okay? So I'm going to hit it just like this. And you may be able to hear that. And then I'm going to just put this here. So here we go. Do you feel that? Okay, good. Okay. And we're going to try this again. We'll put this on your leg here. You feel that? Good. Okay, great. All right, let's try one more time. Let's put this right here. Okay, great. That's fantastic. Okay, so vibration sensitivity is normal. So now what I'm going to do is I'm going to use this light here. And what I'm going to do is I'm going to shine this in your pupil area. And you're just going to look, if you could, in fact, you could look at these posters behind me here. And I'm just going to try to just glance at your cornea and your sclera and make sure that there's no abnormalities. Okay, so let me do this here. So go ahead and just follow this light. Okay, good. We're gonna go this way here. We're gonna go this way here. Okay, let's just bisect here. Okay, fantastic. Okay, and just one more time here. I'm just gonna go really close. Okay, and on your right eye, sclera is normal. No abnormalities. Okay, fantastic. That's looking great. So we've checked your eyesight. And now I'm gonna put this down over here. Okay. So now next on our list, I'm gonna go ahead and put this here. this here. And I'm gonna have you go ahead and, in fact, I'm gonna need my light again here. I'm gonna have you just go ahead and say, just open your mouth here. I'm just gonna check your tonsils here. Good. A few more moments. Really wide. Thank you so much. Great. Yeah, okay. Thank you so much. Now let me go ahead and just toss this to the side. And now we are going to go ahead and we are going to check your ears here. We're gonna be opening this here. Now I'm going to take this and I'm going to use my other light here. I'm just going to come to the sides here and I'm going to go ahead and check your ears real quick. Fantastic. Okay, so I'm coming here. Okay. Okay, and I'm coming over here. It's looking normal currently. Okay, great. Okay, now what I'm gonna do here is, let me just go ahead and throw these away. Now, what I'm gonna need you to do is I'm going to go ahead and I'm going to come to the sides here, and I want you to go ahead and tell me, this is gonna check your peripheral vision. So I want you to tell me when you see my hands. I'm gonna have them come around, okay? So here we go. Okay. Fantastic. All right, let's try this one more time. I'm gonna come around behind you. Here we go. Same thing. Okay, and good. Okay. Fantastic. So, no abnormalities. Everything is looking healthy so far. Ears are looking healthy. Eyes, scleras clear. That's fantastic. Let me go and write down some of this here. So quickly jot this down. And there we go. Okay, so I'm gonna go and put this back on. So now, let me go ahead and wash my hands, and I'm gonna go ahead and now what I'm going to have you do is I want to check to listen to your abdominal region, your chest, just to make sure that everything is going well there. And then we should end probably right around there. So I'm going to have you take a seat over here on our table here. And I will test your reflexes. I'm going to use my stethoscope, and we're going to just make sure that everything is good there too. Mm-hmm. Absolutely. Let me go ahead and, yes, of course. Let me go ahead and put on some gloves. number 1, and we'll put the proper glove number 2. Okay. So we got our gloves on, and we're gonna go ahead and take a seat right over here, okay? Fantastic. Okay, great. Come on. Okay, so before we go over there, you're saying that you have something you want me to wrap, just an injury in your arm. I have the perfect thing here. Let me just grab my kit. Okay, great. Let me just go ahead and give you this. Looks like you do have a little sore here. Let me just quickly wrap this. Okay. Now just give me a second because I want to give this a quick clip here. And let me just hold this tight. Okay. Okay. Fantastic. And there. Trash. Now, let me go ahead and have you take a seat over here, please. Fantastic. Thank you so much. Okay, so I'm gonna go ahead and take these little cotton buds and I'm gonna just go ahead and dab them. And tell me if you can feel this. Close your eyes and tell me if you can feel this, okay? Okay, fantastic. Here we go. Okay. 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 Okay, fantastic. That's great. So let me go ahead and put these over here. Okay, great. So now what I'm gonna do is I'm gonna have you just, I'm gonna use my little handy reflex tester here. And I want you to just go ahead and tell me if you feel this here. So I'm gonna go ahead and just hit on your knees here. Okay. And one more. Okay, good. Try one more, okay? Okay. And one more time. Okay, fantastic. That's great. Okay, so now I'm going to go ahead and ask you to again join me over here. We're going to have you sit down here, and I'm going to put this over here. So I'm gonna have you. Okay, fantastic. Okay. 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 So now I'm gonna have you go ahead and lie down or sit down here, and I'm just gonna have you once again I'm gonna be palpating your facial area here, and I'm just gonna be checking for any abnormalities or anything like that. And I'm also gonna have you just once again follow my movements as well, if that's okay. Okay, great, thank you. So now I'm gonna go ahead and use my stethoscope here, and we're going to just listen to your heartbeat real quick. So I'm gonna go ahead and just slide this gently on your back here. I hope that's okay. Okay, fantastic. So we put this here. fantastic. Now let me just go ahead and put this on your abdomen here. Okay. So I'm going to just go ahead and put this one more time. I'm going to put this here. Okay, fantastic. It sounds normal. And what I'm going to go ahead and do is I'm going to have to just go ahead and count your pulse really quick. So if you could just give me your... Yeah. Here we go. Just 30 seconds. Okay. Fantastic. Okay, great. So that is normal, and everything sounds really good there. Now I just have one last thing for you, which is to come with me over to this side of the room, and we're going to go ahead and do an eye test just to make sure that your vision is okay as well. Okay, fantastic. Why don't you come with me over here? Thank you. Okay, so now last but not least, I'm going to have you go ahead and just tell me what you see on the board here. So we'll start with the top line. Good. Line 2. Excellent. Line 3. Line 4. Line 5. Line 6. Line 7. 8. 9. 10. 11. Fantastic. Okay, great. That's so wonderful. Fantastic. All right, so thank you so much for coming through here to the clinic, and everything looks really normal and healthy. If you have any other questions or you'd like to schedule another appointment sooner than later, I'd much appreciative. In fact, I've got a little appointment card here. I'd like to just schedule that second appointment if possible. Now, let me just put this here. Okay, let me go put this here. You had that injury, so I'm gonna go ahead and I'm gonna give you a prescription for that, and let me go ahead and send this prescription to the pharmacy, and let me just get my appointment card. I'd like to just get a follow-up if possible here, maybe perhaps sometime next week here. How about June 1st at 9 a.m.? How does that sound here? Dr. Nathan. Okay, great. I'm going to give this to you here, and you can talk to the front desk receptionist on your way out if you have any other questions. All right, thank you so much.